Hey, it's Dr. Ryan with Movewell, Physical Therapy and Performance in the Ahwatukee Foothills. In this video, we're gonna go over 5 exercises that you can do for lower back pain. Let's get into it. All right, exercise number 1 is prone on elbows. So with this, you can hang out in this position on your elbows while you're watching TV. It's very simple to do, or you can move up and down into a repeated motion. If you don't have any tightness with that, you can advance it, where you're doing a cobra pose, pressing up and down. I like to hang out in this position for 3 to 5 minutes. As long as you don't have back pain or it doesn't flare up your back, then it's totally safe to do, okay? If it does flare up your back, as with this one or any other exercises, maybe don't do it and see a professional. Now, sometimes after being in this position for a while, you can be a little bit stiff coming out of that position, and that's where it helps to get some gentle movement, range of motion, doing some cat-cows, going down into a child's pose. But the next exercise we're going to do is for core strength. This one, you're going to lay on your back. You're going to flatten your back out against the ground. We're not going to over-accentuate a pelvic tilt, but just enough so that your back is flush with the ground beneath you. So with this, we're going to bring our arms straight up. You're going to flex your ankles, and starting off, you just want to start breathing. Breathe in through the nose, breathe out through the mouth. And you're going to do 10 breaths. Every time you breathe out, you're going to engage your core even further. Now, if that's too easy for you, you can make it a little bit harder. We can tap one heel down at a time. We can move opposite arm and leg. We can go into full extension. And that's a full dead bug. From there, you can transition to this tall sitting position. We can do arm raises here, getting that shoulder flexion, overhead reaching is also going to work on thoracic extension. So I like playing around with this position. Dead bugs, right? You can just work on heel taps, keeping the back flat, transitioning to this tall sitting position, right? You do a few rounds of those, and you're really going to feel it burning. The next one is a glute bridge. Very simple, very commonly done for lower back pain. Bringing your hips up, belly button in. If it's too easy to do it on 2 feet, you can do it on 1 foot. Okay, next is a hip flexor stretch. On one knee, foot in front, pelvic tilt, shift your weight forward, squeeze your glute. You should feel a good stretch in the front of your hip. This helps to prevent, or this helps to correct an anterior pelvic tilt, which a lot of people have. A lot of people are walking around looking like this and wondering why their back hurts. It's because you're in an anterior pelvic tilt all day. Your abs are disengaged, your glutes are weak, your hip flexors are tight. Okay, so that's the next one. Hip flexor stretch. In order to make that stretch harder, you can grab your foot and pull your heel towards your butt, trying to maintain that neutral lumbar spine position. Last one is just a hip hinge. So you're going to stick your hips back, slight bend in your knees, and you come up. Squeeze your glutes. So this is just a RDL, okay? So you want to start off with no weight, just working on keeping that proper spine position. And then over time, you can add weight to it, and that will help to build strength in your glutes, your hamstrings, and your lower back itself. All right, now that you've seen those exercises, you are completely free of lower back pain, and you will never hurt again. And everyone that does those exercises will eliminate their back pain immediately. No, obviously that's not the case. Number one, it is important to have a consistent routine that you do. If you have pain in your lower back or anywhere else in your body, the most important thing is that you do something about it. Sitting on your butt, having poor posture, not stretching, not doing strengthening exercises, of course you're going to have chronic pain. So if you're someone who maybe doesn't take care of yourself physically, you probably shouldn't run to get imaging, injection, surgery. Like, there's so much that you can do to improve your pain levels and improve your function conservatively without those things. And that's where we come in with our company and with physical therapy in general, is to try to reduce pain, improve function naturally. Just having a routine that is specific to how you present, right? That's the most important thing. Everyone is going to present a little bit differently. They're going to be a little weak here, maybe a little tight here, maybe this joint is is immobile, right? Everyone's a little bit differently, and that's where having a good professional can help to address those things. So if you or someone you know is struggling with lower back pain or other orthopedic injuries, you can check us out online at www.movewellaz.com and fill out the form, and we will be happy to help. Thanks for watching.